No? Okay. Thank you so much, Carrie. Thank you, everyone. I am so humbled and excited to be here with you all. As Carrie mentioned, my name is Vanessa Castro. I use she, her pronouns, and I'm the Deputy Director of HIV and Health Equity at the Human Rights Campaign Foundation. And I'm here to share the good news regarding a new program that we've launched called the Interfaith Health Equity Alliance Roundtable. The Interfaith Health Equity Alliance Roundtable, as we lovingly are now referring it to I Hear, because it is a little bit of a mouthful. I would be remiss if I didn't share the mission of the HRC Foundation. And the HRC Foundation seeks to fundamentally change the way LGBTQ+ people are treated in our everyday lives. LGBTQ+ people are in every community, every profession, and every culture, and yet often face enormous obstacles simply because of who we are. The HRC Foundation works to build capacity and change policies, practices, hearts, and minds in a range of institutions that shape our daily lives. And our I Hear mission is the Interfaith Health Equity Alliance Roundtable. I Hear is a network of faith leaders committed to providing educational resources and tools to eradicate HIV stigma and discrimination. We aim to empower other faith leaders to tackle health inequities disproportionately impacting their communities and improve overall health outcomes for everybody and everyone. And we do have some familiar faces in the room. I would need to give my flowers to Reverend Dr. Sandy Bailey Gwynn, Elder Carmarian D. Anderson Harvey, and Carrie Goodman, who have been instrumental in really getting this group together. And just to give y'all a little bit of background, we actually had our first meeting in Birmingham, Alabama in June. And we have 10 amazing individuals, faith leaders across the country, as you can see, from Georgia, Alabama, Florida, North Carolina, representing a coalition of partners who are committed to really developing information and resources for this new program. And at the end of the day, I think it's really clear what our motive is, right? I think in our conversations earlier today, it's really around the fact that now is the present, right? Now is the time for us to do this work, given the rise, as we see, of these anti-LGBTQ+ legislations. As you can see, HIV is still being criminalized across the country, right? We have outdated policies that continue to stigmatize people living with HIV. We're committed to tackling the barriers that people living with HIV face intentionally or unintentionally in spaces in which they seek community and affirmation. And then I think really just kind of speaking again to what was said earlier, faith communities have been pillars when it comes to the HIV epidemic and continue to be those voices and leaders in our communities. One of the first big things that we're doing as I Hear is we're actually developing some e-learning modules. We've decided that this is really a great way. My ears were perked in the conversations earlier of what we can do, right, to really take this information and transform communities. We've developed a couple of modules focusing on a couple of different topics that we think are important for us to continue to talk about. The first one being stigma and discrimination, right? And really thinking about wholeness, wellness, and that includes sexual and spiritual health. I think sometimes we tend to separate the two, and the reality is that we need to talk about, when we talk about health, it encompasses all these different aspects of the individual. So we want to continue to kind of create this more holistic approach when we talk about that. And then finally, compassionate care. How are we actually talking about issues and situations that affect people living with HIV? We want to create soft landings and brave spaces for people to show up in their full selves. At this time, we're actually focused on finishing up our stigma and discrimination module. We'd like to actually pilot this. Obviously, this is something that we've developed together as an advisory council. We are hoping to have a workbook to further enrich this experience and again, really create and strengthen those networks of advocates to ensure that they have the tools and resources to not only learn about this, but how can they apply this in their communities, right? I think that speaks to the overall question earlier. What are we doing with this information? So how can we apply this information that we're learning to communities to not only affect, the faith leaders, but people outside of that community as well? These modules are intended to be interactive and really allow, again, faith leaders to have those tools and resources to dismantle deep-seated myth and misconceptions around HIV. And as I mentioned, we've done a lot in these last couple of months. We just started in June. We are in September. So, we're still moving along. Something that we're really trying to develop is really creating an ambassador program of other folks who are interested in getting involved, finding out how they can bring this to their communities. And then again, as I spoke earlier, we're looking for folks who are going to support us in piloting this information, right? We want to ensure that what we've developed resonates with your communities and is something that you all can take and, again, utilize in your spaces. One of the things that we're actually really hoping to do with this program is we want to make equity the forefront and the center, right? So we want to ensure that this is something that people of all faiths are able to utilize and have these conversations, right? Because sometimes it's just important for us to give people the foundation in terms of how to begin to have these conversations and what are the actions that can come away from that. So I ask all of you, if you are interested in learning more about this information, our pilot program or becoming an ambassador, if y'all wouldn't mind, I have a QR code here to scan and would love your feedback if you're willing and able. And I will provide on this next slide my contact information. Obviously, if you see Carrie or myself, we're happy to talk to you more about it. And thank you again so much for having me today.
For a lot of us, and I'm only so we can understand we can compare. I know a lot of institutions are also modeling to safe spaces with training. What is going to be different with us with HRC compared to the others that are going to be offering capacity building trainings around HIV and faith spaces? Your board.
I think what's going to be different, and I'll speak a little to this, and then Carmarian, if you have anything you'd like to add. HRC is not unfamiliar to faith spaces. We did have religion and faith programs. So I think with this, we're trying to be more intentional, right? We want to create a network of individuals who are not only doing this work, but we want to, again, focus on other areas. I know there was a conversation around trauma, right? Around being able to have these hard conversations. Really being comprehensive when we talk about this material. And again, I think the piece is we want to make this available to anyone. We don't want this to be cost prohibitive. This is something that we realize is a need in so many communities who want to ensure that everyone has access to it. So I think what makes us a little bit different is the fact that we're ensuring that we want to continue to find collaborators, right? We don't think that we have the end all be all solution, right? When it comes to these conversations, obviously many of you who are working on these issues as well and trying to develop things of this nature. And so I think it's really about strengthening this coalition of individuals who are really committed to this work and understanding how we might be able to support other faith communities. As Carmarian mentioned earlier, I think really going into those spaces and doing an assessment, right? I think faith leaders are, better positioned to understand what the needs of their community are. We aren't necessarily trying to come in and say, this is what we think y'all should learn, but here's some tools and resources that might support the work that you're doing in your faith spaces.
I think the only other piece I wanted to ask the question to be, so people realize with HRC, as you know, we also have a C4 on, which is going to be our legislative policy. And one of the things that we did notice.
One of the things that we did notice is building advocates to show up during the time around legislation, but more importantly around intersectional things that impact us, particularly in faith spaces in Black church. And so we're hoping that this will give an opportunity to use also, if I may, use that quote unquote privilege, that we might have with the resources we have and with, you know, with all of the key people that we have to get this pushed in. We also discovered that there are other trainings that are out there that we also have. And I think Carrie has been talking to, collaborating, just to make sure we're not trying to duplicate. What we're trying to do is get into spaces perhaps where those other trainings are not, because every institution have their own avenue of getting into certain places. And I think this is a great opportunity. I do want to emphasize as well that HRC, our national office, no longer have our religion and faith department. So I know that may be news to some, but it is no longer going to be a department. So adding this type of things to our foundation side and those that will run a remote office like myself, we have one clergy in an entire HRC, and that's me. And then we have a second clergy who is resurfacing, who's a phenomenal leader in Mississippi. So it's not many of us. And so again, intersecting this with some of our works is we're not a direct service, but we do offer resources. We'll keep culturally what we need in order to reach those other hard to reach places, because we understand that religion and faith is a culture. It also can be a barrier, but it's also a benefit for some of us who still adopt that faith side of ours. So thank you.
Did you have one there? Let me. No, I'll be Vanna White. It's okay. I'll on you.
Thank you. Hi, I wonder if your e-learning will have CEUs available, because sometimes that can be a draw for some clergy.
Yeah, we recognize there could be some incentive with adding that, and we're actually doing some research to see how we're able to make that possible. Again, this is why we're having this pilot, to kind of figure out, is it something that we need to incorporate, right, for the duration of the modules that we have. So this feedback is really instrumental for us to figure out how we want to shape these modules.
I want to add that I'm really excited about this pilot. We are at the Faith Coordinating Center at Wake Forest University School of Divinity and have a similar offering through our blackfaith.org website. What I'm interested in knowing is, how can we leverage our collective impact by offering these kinds of online modules, by sharing data, by sharing outcomes and things like that? Because I think if there are multiple spaces where we're reaching various kinds of audiences, it'd be good to kind of understand the collective impact that we're all having in the space to see if we're moving the needle at ending the epidemic.
Well, I think we should have a meeting and a conversation. I think that's going to be our next step, right? Again, I think it's really important for me to emphasize, we don't think that we know everything, right? We don't have all the answers. We're reaching we have a different approach. Obviously, given HRC, we want to try to reach these hard to reach places, but I think it's really getting us all together and figuring out, how are you all tackling this conversation? What are the elements that you're adding, and how might we enhance those, right? Because I think this is really about an enrichment process. This isn't just a siloed approach, right? So I think having this conversation and meeting with other folks who are doing this similar work is going to allow us to, have that greater impact and show, funders in the future, hey, y'all, we're onto something. It's time that you all listen and provide us with the resources to be able to do this work. Mm-hmm.
Oh, I'm sorry. Carrie made a very good point. That rule is just not in the South. Are we open up to having ambassadors throughout the United States, or are we just looking at the southern states?
No, I think the whole country. I think it's really important that we have representatives, right? Again, I think it speaks to the fact that we want to create something that's going to be useful for people anywhere, right? Because again, back to the mission, this is something for everybody and everyone. So I think we are looking to see how we might make that a possibility. So we have folks, and maybe that's something we can have a conversation about, how can we have ambassadors over these different programs speaking to the importance and the significance of this work.
Thank you for this presentation. One of the hats I wear is I'm the national chair for the National CFAR CAP Coalition, N3C, and we have a faith and spirituality working group. So we would like to talk to you about how can connect the faith community and researchers, because that's how we're going to, we need to get that data. Thank you.
Thank you so much. Yes, and I actually will go to the next slide. Here's my information, my email. Kerry obviously is another resource. He's been instrumental helping us get this together. So I welcome any ideas, any meetings. We're really excited, and again, I want to just stress the fact that while we may not have a religion and faith program, this is our way of doing it through the HIV health equity program. So we want to ensure that we are intersectional, we're inclusive, and we're comprehensive. Thank you all so much.
If you have an empty seat next to you, please.